Dr. Larry Corey with the Fred Hutch, renowned expert in virology and immunology, joining us now. You think I would get that word right after almost 2 years of saying it. Dr. Corey, I know that you also spoke with Dr. Fauci this morning, all of you in the medical community putting your heads together about this. What are your thoughts about what the CDC director did overnight, overruling her own advisory panel on boosters and just widening the number of people that can get it?
Well, I give Dr. Walensky high marks. I think, first of all, to coincide with the FDA is the right thing. Second of all, I think that, committees can sort of get into their own issue as if the only thing that matters is hospitalization. The reality is that the licensure of the entire program was to reduce symptomatic disease, preventing you from getting ill for lots of days also. And that is clearly waning, and that is clearly affecting younger people. So I do think Dr. Walensky, I get to call her Rochelle, really made a bright decision and a brave decision, and took a lot of courage on her part and a lot of consultation with the other agencies.
And there's some people who might be concerned, might be a little weary about getting booster shots, and this decision by Walensky siding with the FDA and not necessarily with the advisory committee, that shouldn't really cause any concern for people, should it?
No, not at all. And I'd also sort of say the advisory committee was split. It was 9-6. There was a view of looking at what the issues are. I honestly think, again, as I've said, this third dose really raises your blood levels of the amount of antibody almost tenfold into the thousands. Would you rather have 2,000 molecules fighting the virus, or 400 after the first 2 doses, which wanes down to 40? So do you want 40 or 2,500? Well, I want 2,500. All right, that will help me get it through Delta at a much better rate.
What about those who've had the Moderna and J&J vaccines, Dr. Corey, based on the data you've seen? What are the chances of that recommendation coming soon?
I think the Moderna recommendation will come soon. It is clear that because it's a higher dose, it is actually having better durability. But it is starting to have the chinks in the armor. Delta is a formidable foe. And so they've applied. I think the data support it getting a boost. I'm hoping that the FDA will look at it expeditiously. And the people who have gotten Moderna back in January and February will also get a boost.